Hi everyone, my name is Tyler Walsh and I'm a pharmacist at the UAMS Donald W. Reynolds Institute on Aging. Today I'll be joining the UAMS Center on Aging to talk about medications in older adults. Our topic today will be medications and falls. Now, falls are very common in the older adult. In fact, nearly 30% of older Arkansans fall every year. That's also the national average. But luckily, less than half of these falls actually result in injury. However, it is important to note that nearly 300,000 older Americans are hospitalized every year for hip fractures. Having a fall can lead to loss of your independence or even decrease your quality of life. So let's review some things that can cause you to have falls. Now, there's many things that can cause you to have falls. Some things we might not have much control over, and some things we might have a little bit more control over. First, let's start with things that we might not be able to control, such as our increased age, being a female because females are at a higher risk for falling, having poor balance or a fear of falling, poor vision or hearing loss, and maybe even some diseases that aren't well controlled, such as diabetes or anemia. On the flip side of that, there's things that we can control, such as medications. And there's certain medications that can lead to falls, or maybe we just take too many medications. If we use ill-fitting footwear, if we don't use our eyeglasses, we have to make sure we use our eyeglasses if we need them to see. There's also tripping hazards in your home, such as cords or uneven surfaces like stairs, and even outdoor hazards like porch drop-offs, which is what my grandma, a couple of months ago, she fell off of her porch and fractured her hip. So she was one of those 300,000. There could also be tree roots in your yard, or if you have a dog, they might dig a hole that you won't see. And living alone can make your falls so much more serious because there might not be someone there to help you get up or even get you the medical attention that you might need. So medications are a very common causes of falls in the older adults. And actually, about 75% of older adults take at least one medication that's been related to falls. So over the next few minutes, we're going to discuss some common medications that are used in the older adults that are also linked to falling. First, we have medications that can cause confusion, drowsiness, low blood pressure, and even some blurry vision. All are side effects that can lead to you having a fall. On this slide, you'll see that I have some OTC or over-the-counter medications. And these are medications that you just pick up when you go to the grocery store, and you don't have to have a prescription from your doctor. So the first one I have listed is Benadryl. So I have the brand name and then the generic name. So Benadryl or diphenhydramine. These are those little pink pills that everyone takes for their allergies. But diphenhydramine is also in combination with other things, like it's in Tylenol and Advil PM, because it's what helps you make you sleep, because it makes you drowsy. Another one is doxylamine, and it's not typically sold by itself. It's typically found in cold medications, such as Advil cold and sinus or Tylenol cold and flu. So be careful if you have to take that around this time of the year, because it could cause you to fall. Also, there's meclizine or Dramamine that a lot of people take for motion sickness. And that, again, makes you drowsy and can lead to an increased fall. But remember that this is not an all-inclusive list. If you're going to take something over the counter, make sure you check with your pharmacist first to see if it could lead to a fall. On the next slide is common prescription medications that have those same side effects as the over-the-counter medications, which was confusion, drowsiness, low blood pressure, and blurry vision. And again, this is not an all-inclusive list. These are just common medications that are used in the older adult, such as oxybutynin, which is used for your bladder, or paroxetine and amitriptyline, which are used for your mood. Then there's cyclobenzaprine, a muscle relaxer, lorazepam for anxiety, zolpidem or Ambien to help people sleep, which isn't a good choice in the older adult. We tend to like to use melatonin over the counter because it doesn't have the increased risk of falling. And then there's also pain medications like tramadol and gabapentin and hydrocodone with Tylenol. And all of these medications can lead to you having a fall. But again, it's not an all-inclusive list, so check with your pharmacist or doctor if you think that you might be on something that could cause a fall. The next group of medications we're going to discuss are heart and blood vessel medications. And these medications decrease blood flow to your brain, lower your blood pressure, lower your heart rate, cause dizziness, and maybe even cause you to not be aware of your surroundings. Some examples we have are metoprolol, carvedilol, furosemide, and hydrochlorothiazide. These last two are fluid pills, which you might have heard them called, and the top two work on your heart rate. But these aren't the only medications that can cause falls that are listed here. It's not an all-inclusive list, so make sure you check about your blood pressure medications with your doctor or pharmacist. The next group of medications we're going to discuss are diabetes medications. Specifically, insulin, which goes by Humalog, Lantus, Tresiba, and many other names. So anything that you have to inject yourself with might cause you to fall. And this is due to it lowering your blood sugar. And then these tablets, glimepiride and gliburide, can also lower your blood sugar and cause you to fall. So check with your doctor, because if you're taking any of these medications, you need to make sure that you're also checking your blood sugar to make sure it's not getting too low, and we need to adjust your dose. And then finally, I would like to discuss medications for acid reflux. These medications don't have a side effect that necessarily cause you to have a fall, but they cause you to not absorb enough calcium from your diet and supplements. And so if you were to fall, then you're at an increased risk of having a fracture because your bones aren't as strong. So make sure that you talk with your doctor if you take anything for acid reflux, especially if you take Prilosec or omeprazole, Nexium or esomeprazole, and Protonix or pantoprazole. So what can you do as the patient? You can, to help you know your risk of falling, have an in-depth conversation with your doctor or pharmacist at your next visit. Just during the conversation, ask them for ways that you can prevent falls in your home. Ask them to review your medication list with you to see if you're on anything that could cause a fall. And also, ask them about vitamin D and calcium supplementation. That way, if you were to fall, your bones will be stronger and they might not break. You can also ask your pharmacist to review your medication list at any time and contact your doctor with any concerns that you all might find. Also, the CDC has some great resources for you to help you identify fall hazards in your own home, as well as ideas for different activities to build strength like Tai Chi or physical therapy. So I'll make sure that this link right here gets put down there in the comments for you to go check out their great materials. In summary, I just want to remind everyone that falls in the older adults are very common. However, there are proactive measures that we can all take to help prevent falls and make our bones stronger. That brings our talk to an end for today. Please message or comment with any questions that you might have, and join us next time for more tips on your medications.